According to the CDC, 1 in 4 people in the U.S. suffers from a mental disorder. Here to talk about the importance of wiping out the stigma of mental illness is Dr. Sonia Parikh and Dr. Vidushi Savant, of co-founders of Savant Systems. Welcome.
Thank you.
Thank
Delighted
you.
to be here.
Well, you know, in KTVU News, we have had a lot of stories about mental illness in the news recently. I mean, how does that affect public perception of mental illness?
It definitely makes the stigma worse. People already think that, you know, coming to psychiatrists is it's looked down upon. People might think they're crazy. Getting help means weakness. There are already, you know, that sort of stigma around mental health, and it just kind of adds on to that.
Well, talking about that, your mission sort of statement is stamping out stigma, right?
Yes.
What exactly do you mean by that?
So we founded Savant Systems, which is a nonprofit, and the primary mission is stamping out stigma. And what that means is increasing, you know, our main aim is to increase education and awareness about mental disorders in hopes of improving stigma. And, you know, by increasing understanding about these very real and important illnesses. And, you know, in hopes that people who need care will be encouraged to seek the help that they need.
Well, one of the most pervasive might be, I guess, depression, right, as a mental illness. And a lot of people might think they might not characterize that as an illness, right? But how many would you say, I mean, what do you say to people who sort of say, well, depression is not a mental illness, it's just something that, emotion that you feel?
Well, you know, we all feel sad and depressed at times, and sometimes sadness can be a normal reaction to, you know, loss or stress or injured self-esteem. But when sadness becomes intense and is characterized by hopelessness and feelings of worthlessness, lasts for many days to weeks, and interferes with your function, then it may meet criteria for being clinical depression. And clinical depression is essentially, it is a medical disorder with a biologic basis.
And typically, how would you suggest that people get treated for such?
So basically, I mean, the two mainstays of treatment are therapy and medication, and most research suggests that they work best in combination. There is a definite physical basis for depression, and with better technology, we are able to better see it more and more. So like with functional MRIs and nuclear scans of the brain, we can actually see that the brain of a person during depression or before depression is different, or brain of a person who's thinking normally versus a person who's very depressed worked in different ways, and the medication to some extent does reverse that change. So my goal is usually to first convince the patient that there is a definite biological basis for this illness. If a person with hypertension or a person with diabetes should not feel shame taking antihypertensives or insulin, then why should a person with depression feel shame about taking antidepressants?
Good point. So the opposite of that is your argument that sometimes mental illness can lead to physical illness, correct?
Absolutely, absolutely. Depression and heart disorders, heart disease, are very highly comorbid. And people, so depression is now a risk factor for heart disease, diabetes, and stroke.
Wow.
So
yeah, and if you think about it, you know, someone who's depressed doesn't take care of themselves as well. You know, they maybe don't eat as regularly, don't sleep as regularly. And so self-care can be poor. And then in addition, there's evidence that, you know, that the stress hormones are more activated in someone who's depressed, and inflammation is more activated in someone who's depressed. And so that is one of the kind of intuitive explanations for why medical illnesses may kind of be comorbid with depression.
Well, we don't have a lot of time left, but I want to touch upon something which we were talking about, which is the new immigrant community and mental illness, and the fact that treating it is so difficult. In what way is it difficult or more difficult?
Well, there are many barriers to care for this community. The access to care and their perception of mental health is the stigma is definitely stronger. There's the sense of if they go see a psychiatrist, it's not just about them. They'll bring the family shame. So since in Asian American communities, family is the group is more important than the individual, whereas in U.S., being a more individualistic society, it's reverse. So in this particular population, it's even harder for them to come for treatment.
I see. Well, let's talk, because I don't want to run out of time, about the free workshop and seminar that's taking place on June 4th. Really quick, can you tell us about it?
Of course.
Yeah.
Oh.
So the topic is addiction, and we're going to, cover as much as we can as far as, what leads to addiction, different types of addiction, very common ones like marijuana, even prescription medications that you can get addicted to even though your doctors are prescribing them, and what long-term effects it can have on a developing brain, like a child's, a lot of adolescents use marijuana, for example, or even adults and different psychiatric problems that can arise.
And we also want to, stress the biologic basis of addiction. There's, genetic and biochemical changes that happen in your brain when you get addicted to something. So we also, want to stress that there is treatment for that, and people do, respond to medications.
Well, terrific. Thank you, doctor, so much for being here with us.
Thank you.
It's our pleasure.
For more information about Savant Systems and its free workshop and seminar on addiction on June 4th in Los Altos, log on to stampoutStigma.us. Up next, East Bay Mud's Charles Bolig explains the new water use rules affecting all customers and shares some tips on how you can reduce your water use by 20%. That's coming up when Bay Area People continues. Stay with us.